Good morning. Thank you for joining us for our fourth installment of the speaker series this spring semester 2026. Today we have a wonderful and exciting speaker who started at GW Nursing in the ABSN program, is now completing his DNP and the FNP program here at GW Nursing, while establishing a wonderful global health organization called the Elijeko Foundation in Ghana. So without further ado, he'll introduce himself a little bit better than I could. I want to introduce Andrew Nyantakyi.
Thank you. Thank you so much. Good morning, everyone. I just want to thank the leadership of this school. I get very excited whenever I'm asked to come here and interact with students, and both present and the past. I love this school, and actually they got me to teach here too, so it's a beautiful thing. I'm very happy to share my story, my journey into healthcare, and what we've been doing through Elijeko Foundation. This organization has been going on for about 12 years in Ghana. I started a nonprofit when I was in the Navy, and I'm going to share more stories, and I'll be happy to take questions afterwards. I talk very, very fast when I get excited, so I'm going to try and slow myself down, and I think we'll have a great conversation today. So as nurses, we communicate using the S-bar. And always when I go to places, people ask me why I choose to do the things that I do, and I want to communicate with my nursing students using S-bar. So there is this beautiful young lady who situation happened in Ghana. She was 29 years. She went to have a baby at the hospital, and she received a wrong medication. All right, the background, she's a pharmacist, previously healthy, was mistakenly administered an injection at the local hospital that led to her becoming paralyzed. All right. The assessment, the patient is now completely paralyzed, unable to walk or care for her children, and requires full-time assistance. Recommendation: immediate advocacy, increased voice, education to address patient safety awareness on the broader scope. This is why I do what I do. There are many people. This one, she's educated. She's a pharmacist. But then she went to a hospital and got injected with medication, and now she's paralyzed. I've taken it upon myself to move around everywhere in West Africa to promote preventive health education and to provide people adequate information so that they can be better prepared to take care of their own health. Just a little bit about me. I'm a father of 4. I'm very busy. I have 2 boys and 2 girls. I spent 8 years in the Navy as a hospital corpsman. I came to GW. GW sent me to be a nurse, and I currently work at Holy Cross Germantown Hospital. I'm working on my DNP, almost done, and I have an Elijeko Foundation, which is in Ghana. Yeah. So what defines me? My extensive military and civilian experience. I've done a lot. I've seen a lot in the healthcare settings, but GW did prepare me very, very well. I have good leadership experience leading Elijeko Foundation. Our foundation is self-funded. We use volunteer-based approach to reach everywhere in West Africa. There's nowhere in Ghana that people have not heard about Elijeko Foundation and the things that we do, and we expand to other countries. And I'm very committed to patient safety. Patient safety is very, very important to me. So my mission for life is to be advocate for patient safety. Patients do trust us when they come to the hospital. The last thing we want to do is to leave them going home very bad than they came to us. So I really want to continue to focus on patient safety, and I'm continuing to work and with my team to innovate our ideas on a nonprofit, so that we'll be able to be more impactful than when we started. And I also want to train more. Anybody that's worked with me before knows that I love to train. I love to grab new nurses and show them the way, because we are going to be able to build the next generation of healthcare workers if we show them the right way to take care of patients. And I love networking. I go everywhere, I make friends, and I try to do the best to support whoever I can. So I'll talk a little bit about my nonprofit. Again, I love stories, because when you use stories, you are able to get people to understand why you do the things that you do. And I have many stories as to what led me to start Elijeko Foundation. But this is my mother, and she lives now in the U.S. And before I relocated her to the U.S., she had to travel 4 to 5 hours away to be able to get access to health care. And she doesn't make any money. So accessing quality healthcare, being able to pay for healthcare was a big thing for her. And just looking at Ghana also, very huge, and there is limited access to it. She never went to the hospital. She doesn't have access. Like, oh, I'll go to the hospital. There's no doctor to take care of me. I don't have money to pay. I don't have money to buy medications. I'm like, maybe there's a way we need to start educating people so that if they don't get sick, they don't have to go to the hospital and overburden the hospital. So she was one of the inspiration for me to start Elijeko Foundation. Right now, we have served about 10,000 people through our clinic projects, and our organization has changed, and I'll talk more about how we have changed. But our community outreach program has reached over 200,000 people through Ghana and some West African country. So now Ghana's population is 35 million, all right? And out of the 35 million, 72% of these people do not have access to quality care. And that is the goal of my nonprofit, to make sure that we reach everyone with health education, help them prevent sicknesses so that they don't go and overburden the current healthcare system that we have. Our solution is very simple. We talk to the peoples in the community. We go to them, we ask them what information about healthcare do they need, and we try to provide the information to them. We are not sitting somewhere and manufacturing something that we think will be beneficial to them. We'll go to them, we'll talk to them, and we'll try to answer their questions for them. So these are some of the people that we've worked with. We started our project ideas, like I said, it was creating awareness, all right? Want people, if they're having issues with malaria, let's go to the community and teach about malaria. If they have cholera, let's go to the community and teach about that. So we created awareness, and our organization started by the radio program, where we go to radio, we have doctors and nurses, and every day they are on radio with different topics. We let the community bring topics to us, and then we'll discuss with them on radio. And we did social media also, and it was very, very nice that people were getting information. People call on the radio and say, hey, my doctor gave me this medicine. Could you explain how I take it? And the doctors will call them and give them education in that aspect. But then we also did community healthcare outreaches, where we wanted people to have one-on-one opportunity to speak with the nurse, to speak with the doctor. So one of our approach was to go into the community and do free health screening. And we did that for a while. Our focus really was on schools and rural communities, because people have to travel 10 hours, 5 hours to access hospital. We wanted to be closer to them. Then we also, because we wanted to bridge the gap to healthcare access, Elijeko Foundation started to develop mobile clinics, where we converted shipping containers into clinics and put it in communities, so that when somebody needs an urgent care services, they can go into our clinics for healthcare services. So all the services that we provided was free, and this is some of the concept of our kiosk clinic. So we have them around Ghana, where people can go and have access to free health screening. But like I said, our ideas have changed, and now we are doing something more. So we are not really doing more of the kiosk clinic project. We are doing more education now in our nonprofit. And like I said, we've redefined our mission, all right? Because as an organization, you have to reinvent yourself to be able to suit the current line of things that are going on. And we did our needs assessment, and we realized that there is more areas that we could serve Ghana better than providing free access to healthcare. And gladly, there's more organizations coming to Ghana providing free health screening. So now our focus is to continue to drive awareness. So all we are doing is that we are targeting individuals and organizations in Ghana and teaching them on how to prepare for emergencies. I was in Ghana, spent 3 months in Ghana, and everywhere I went, I told people that I feel like there's something going to happen in West Africa or even around the world that people wouldn't know how to respond to it. So it is time for us to start preparing people so that if anything happens, we'll be able to respond to it. So what we have been doing in our organization is identify agencies throughout Ghana, and every year we spend time with them, teaching them on basic trauma care, basic emergency care, pre-hospital care, and disaster management, just to get them prepared. So we've done work with the Ghana Army, and currently we are working with Ghana Fire Service. So our goal for 2026 is to train 1,800 fire service personnel. And our big goal is really to make sure that they are equipped to train other fire service personnel. So Ghana National Fire Service has 8,000 employees, and we've picked 1,800 of them to train them so that they can go back into their facilities and provide training. Because when it comes to Ghana, fire service personnel, they go to homes and respond to fire outbreak. But what did they do if somebody is having a cardiac arrest? You know, what did they do if they land at somebody on a vehicular accident, which is very common in Ghana? So we want to really be able to prepare them adequately so that they will be able to respond to all cases, not just fire cases. All right, so I think this is April now. If we do our training tomorrow, we would have trained 500 out of this 1,800 people so far. And these are some pictures of our trainings that we do. The picture on that far side, with all my trainings, I share condoms. So I give free condoms. And I think it's one of the ways to engage people to participate more. And it's also a way of creating awareness, right? Preventive health is one of our visions. So we do training, and this is some of the pictures of us training. So we are traveling throughout Ghana, and Ghana National Fire Service has 17 stations, and we are going through all the stations and training 100 people at times. So by the time we are done with this year, we would have trained 1,800 people. And when we go, the beautiful thing about our organization is that we don't work alone. We work with a partner. So when we go to each training ground, we provide free health screening. Even though our organization does not do the health screening, we have another organization that is talking about, you know, cardiac health, you know, so they do free health screening, and we do vision testing for them. So with the military, we do the same thing, and with fire service. So I don't work alone. I have other organizations. I call them the implementation partners that travel with me to provide the training and care services to people. And sometimes as an MP student, I get to talk to people and just practice some of the things that I do on our mission field. I love the things that we do. It's been a wonderful experience being able to share the knowledge that I got from the Navy. And I'm always thankful for the Navy. And I think when we do the Q&A, there's a question about how my life changed. Because I was never healthcare, you know, but I'm grateful to the U.S. Navy, and also grateful to GW for giving me the skills to not only be able to impact patients here in the U.S., but also be able to impact people around the globe. More pictures, you know, this one volunteer in blue, she volunteers with us, and she's in medical school, you know, and she actually is being sponsored by my organization to go through medical school. So it's an exciting thing. Thank you so much. This is all I have to share, and I'll be ready if there's any question. Hopefully I didn't talk too fast, right?
No, that was great.
Okay.
Awesome. So I just want to make sure that we can both get on the screen here for the live stream and that we're both visible before I start the Q&A portion. So we are going to do a short Q&A. I have a couple questions that are tailored towards, you know, getting those stories that he mentioned out of him that are really tailored towards nursing students and how they can conceptualize getting into this type of work themselves. So am I clear on the live stream? Wonderful. This is on. Great. So while I'm conducting the Q&A interview portion, I do want anybody watching in the audience to be thinking of any questions that they might have for Andrews, and we'll have some time at the end to get some live questions from the audience. So if we're all set, my first question, which you already alluded to, is you said that you were in the Navy and you were in computer science even before that, and you entered healthcare. Oh, we're going to switch. And so can you tell us a little bit more about, I imagine there's a story there about that transition towards nursing.
Yeah, there's a story there, and I always have a story to tell. So I started my career as computer science, and there's this woman that came into my life. She was a counselor back in Ghana at my school, and when I went to her, I showed her my credentials, and I'm like, I want to do computer science, because in those days, growing up in Ghana, when you do IT, the girls like you, so I wanted to do IT, and she looked at me and she said, I think you should be a doctor or a nurse. And I'm like, I'm not doing that. I just want to do computer science. So I did computer science, and I moved here, and I was interested in joining the military. But the only job the Navy had for me was a hospital corpsman. And I'm like, what is that? But before then, backstory, walking down in Ghana one time, I saw somebody have a seizure. and the person didn't survive, and I just didn't know what to do. Everybody stood there. So when they said I was going to be a hospital corpsman in his medical, and they said beautiful things, and I'm grateful for my recruiter that he was able to persuade me to do hospital corpsman. So when we went to San Antonio, our first training was what to do when somebody is having a seizure. Just turn them to the side so that they don't aspirate. Actually, that was one of the inspirations for me starting a nonprofit organization, Elijeko Foundation. So being through the Navy, I was stationed at Walter Reed, and I had my first child. And she aspirated meconium. And I actually loved how the nurses took care of her in the NICU at Walter Reed. Even though I worked in the ER as a hospital corpsman, I just never experienced the kind of nursing that they gave my daughter. You know, I would go there and I would laugh with them, but drive home crying, just leaving your child in the NICU for 7 days. But they took very good care of her. So they were one of the reasons why I decided to be the nursing field. And when I left Walter Reed, I went to my Marine Corps Recruit Depot in South Carolina, and I had amazing nurse practitioners and nurses trained me. You know, so they were my inspirations. I ended here, and I think I'm stuck. I'm never going back to IT.
Wonderful. That's exactly kind of what I was expecting you might say. So as we know in the nursing school, a lot of the students go into this for mission-based work. So this is your drive. It's what motivates you. It gives you the energy. So it ties into my really next question is, you are so busy in the ABSN program, and we already know that the ABSN program is often a fire hose of coursework and clinicals. So how did you manage all of that?
Okay, I'm so busy. I'm so very busy. But I think to all the students listening and maybe watching, having a friend on campus is one of the best. That is how I survived. I have a friend called Lucy, and we are still in touch. She was my accountability partner. She made sure that I'm keeping up with my classes, because just imagine having children and having all this project here, and she was very helpful. So I always encourage the student, even when I come here to teach, I'm like, hey, I'm asking, do you have a friend that you're studying with? Because Lucy was my uncle through nursing school. She was good with farm, so hey, I'll go to her for all the farm lessons. So I think she was it, and also my wife was very big supporter, because she would watch the children so that I'll have the time to study, you know. So having a support system at home and also finding an accountability partner on campus is also helpful. Yeah.
Nice, perfect, great answer.
Yeah.
Not that I'm, not that this is a competition.
Okay, hey, listen, if I win something, I win,
So often students can have this mission-based objective, and they really want to get into maybe community health, global health, public health. And then, they're doing the clinical work in the ABSN program, but they don't really know where to start. Where did you kind of get the not even motivation, but where did you get the first steps to make this into something real?
Okay, so I think since I have been doing this for a long time, it's very difficult to go back and remember it, but I just having the love for whatever you do is the first step. But also GW has an amazing office. It's called Office of Entrepreneurship and Innovation. So if there's any student here who needs ideas, who needs somebody to help them refine their ideas, they could use the Office of Innovation. But also you have the drive, talk to people and see what they need, and talking to the OIC. They are very, very amazing, and they have the NVC. It's a competition that students will bring their ideas out, and then they will see, and you can win some money. I actually was part of that competition, and I won some money. We don't have enough nurses participating in that program, so I encourage all the nursing students here to, if you have any ideas, just run it by the OIC and join the NVC competition, because you just never know where your ideas will end you.
Wonderful. And if there are any students watching, you can reach out to the student services here at the GW Nursing School or admissions, and we can connect you and try to work with you to, flesh out an idea towards that entrepreneurial fellowship or grant that you're looking towards. What struck me as somebody who wants to get into global health personally is you do it all. You do the advocacy, you do the capacity building with the individuals who are already in the ground doing similar work that could be trained to do the exact needs that you need filled in the gaps. How did you identify the gaps that you're filling?
It's just by talking to people, all right? And I'll start in my clinical work. When I see new grad nurses come in, I just go to them and I just ask them, what are you struggling with? What can I help you? It's the same approach that I do with the communities, even with the fire service. I met a few fire servicemen, they were drinking. I'm like, do you know how to do CPR? And they're like, no, we don't. I'm like, okay, then let's do the training. So I talk to people. So there is nothing wrong with going to people And because that is where you identify need, that is how you identify gaps that you could fill, so just talking to people will be the biggest.
Yeah, and I like that you know, and this isn't one of my questions, but I just really liked that you talked to people in the middle of your implementation. So you redid a needs assessment and you pivoted to meet the new need that you identified.
Yes.
Yeah. I really want to understand what you've done so many impacts, you've reached so many people, you've done so many different implementation projects to address different gaps. What impact are you most proud of so far?
Oh, there's a lot of them, but I think the ones that I'm very proud of and I still save them is when I get a text message from somebody and saying, hey, I was in your training, I had a family member have a heart attack and I was able to do CPR. And that brings me joy. That gives me the drive, because if you've never lost any family member, it's different. If you're a nurse and you haven't been in a cold situation, it's different. But the day that you see a patient die because you were not able to intervene, and it's happened to me before, and I want to tell the new nurses, never be upset with yourself if you don't know anything. The only time I want you to be upset is when you don't ask for help, when you don't speak up. Because I've had cases where I froze. I didn't know what to do. So some nurses will grab me on the side and say, hey, this is A, B, C, and D that you have to do. So I think my most fulfilling thing is just hearing the stories people tell me of how our trainings have impacted them and the lives they were able to save. Yeah.
Wonderful. That's one of the best capacity buildings that we can do in public health. So you were a medical corpsman before, and then you went to nursing school. So from nursing school, from the ABSN program, what clinical skills would you say have been the most useful in this work that you're doing now?
Clinical skills, a lot of them, but communication has been one of the things for me, because I talk very fast and I have an accent, so just being able to have your patient understand you better, and that is what GW did for me. All the instructors taught us on how to better communicate with patients and their family members. I always tell people in my clinical setting that I do patient-centered care. Well, that is what GW told me to do. I was taught to do patient and family-centered care. So I involve the family members in the care of the patient, and that is something that has been very helpful, to me. Nurses will do amazing things, but you don't do much if you don't have a good communication between you and your patients and their family members. Yeah.
Nice. And the communication to identify the needs in general at the beginning. Yeah.
I think I love to talk. I talk a lot, so.
I mean, and you said that you're story-based, and I think that really resonates in public health and in nursing. It allows that interpersonal relationship and trust.
Yeah.
So obviously there's many students, we're based in the United States. There are financial constraints, there's immigration constraints to actually going to an international community or an international setting to apply global health skills. For those who may not be able to travel outside of the United States, what kind of advice would you have for them to get involved in a global health type work?
I think there's way too many avenues, and most of the times we tend to look global instead of looking local, and I've been doing research for my DMP project. I was looking for project topics, and I realized that there's a lot of gaps that needs to be even filled here in the US, so people can start looking locally, and GW does a very beautiful thing where they give us an opportunity to go out and do community health programs. I think I did mine in a shop about 30 minutes drive from here, and it was beautiful just seeing people, even here in the US, who don't have access to quality health care, who don't have access to even get immunizations done, who needs education. So we can start looking locally, Our system's a little bit different. Ghana can just walk into somebody's house, and talk to them. I can do that here in the US, but you can go to Walmart, you can go to churches and just start, communicating with people. And now is the day of social media, so if you have any information, so long as it's evidence-based and accurate, you can go to social media and share, some of the information. And that's also one of the ways to reach to people, just using social media. Yeah.
Nice. So this is the last question that I have for you that's prepared, and then we'll go into a Q&A. So again, prepare those questions if you have any. But if you don't have any, more for me. So last prepared question for you is, if there's one mindset or lesson that you've learned or really held on to throughout this journey that you could pass on to make another student successful, another nurse successful in this field, what would you say?
I have a lot, but I think an attitude of gratefulness is one of the things that I have. I have way 5,000 stories to tell, but throughout my life, people have been somehow supporting me, you know, and there was this old Navy captain. He just died. He lived in Spokane, Washington. He was paying for my tuition fee even when I was back in Ghana. So I'm always saying I'm paying it forward, all right? So when you have that mentality, you know that you're going to do your best to help people, you know. And I'm paying forward for the nurses that took care of my daughter when she aspirated meconium, right? I'm paying forward for that nurse at Innova when I froze around my patient who was dying, who taught me, you know, how to do things. So now when I'm in the clinic and I see new nurses who are freezing like I froze, I just want to help them, you know. So just paying it forward is one of the things that I've been using. And we all have different things that we are grateful for, you know. I'm grateful for this country. It's been good to me. I'm grateful for GW, for the Navy, you know, but I just want to continue to pay it forward, yeah.
Wonderful. Well, that's the last prepared question, so I want to thank you for real quick.
Thank you.
Thank you so much for coming.
Thank you. Thank you for
any
having me.
Q&A from the audience online or here in the lobby?
Andres, what happens to your organization when you're traveling, when you're here? That's question number one. And number two, I'm kind of curious about the technology that you may already use to reach the population that you serve, or if you have any plans to use technology.
Okay. Thank you so much for the question. So I lied to you. I like to take all the credits, but actually the credit goes to the volunteers that we have in Ghana. You know, I have a solid team of people in Ghana that spend their time. We don't even pay them anything. You know, anytime I need them, I put the message there, and they are there to do it. They travel sometimes 10 hours, you know, sometimes 15 hours to just go and share the information. We have a very good database of volunteers, and we have solid volunteers who are everywhere I call on them. You know, I just make the schedule. Even if it's 15 minutes to the program, somebody will volunteer to be there. So I just really want to thank them and appreciate them. Without them, I can't do this. You know, I can't be in Ghana or in the US at the same time. I wish I had that power, but I'm very reliant on our volunteers. As far as technology, I'm hoping that there is a way we could implement technology in our services. So I went to Israel and I spent time with an organization called United Hustler, and they are one of the best emergency responding organizations in the world. You know, they have a 90 seconds response rate. So if something happens here, in 90 seconds, somebody from United Hustler will be there. So we are trying to learn a little bit from their technology and see how we can implement it in Ghana. I really want people in West Africa and even around the world to be very ready to respond to emergencies as good as they do in Israel. Yes. Yes, sir.
Annie, are there any questions on the live stream? Okay. So then I'll ask you a question in the meantime.
Okay.
What would you say is the biggest gap in the healthcare system in Ghana, and is it the same in the United States?
The biggest gap, I think, is access to information. All right. US here, it's easy for people to get information, and in Ghana, it's a little bit difficult. Things are changing, and people are able to ask questions. But even without the gap, there is a cultural effect that happens in Ghana. So in Ghana, we are trained, at least for me, we are trained not to ask people in authority questions, right? And here in the US, I always encourage my patients, ask questions, you know, talk about your things. But Ghanaians don't ask questions from people in authority. So they can go to the doctor, and the doctor will say whatever they say to them. They won't ask questions if they understand or don't understand, you know. So that's one of the biggest challenges in Ghana, that we are telling people, ask your doctors questions. The doctors and nurses are there to work for you, you know, and that is the biggest difference when it comes to gaps in healthcare delivery. It's just that people don't ask questions, people don't have access to information like we do here in the US.
Very interesting. I'll do a follow-up question there for you. If you were to want to transition kind of the organizational structure and the impact that you're working on in Ghana to the United States, what kind of changes would you have to make, do you think? I know that's a really loaded question.
Maybe a lot of the laws and regulations here, just a little bit red tape here. I think in Ghana it's easy, if you're doing the thing and you're doing the right thing, that the community will easily accept you to do it. But I think our license, and even for nurses, there are states that we can't work in because you have to go get the license, and so much regulation. So maybe aside the red tape, I think it's almost the same thing. Education is education everywhere you go, yeah.
Nice. Any other questions before we close out? Wonderful. So any last words that you'd like to impart on the audience?
Last words, whoa. Just let us continue to do what we do to serve the community and just being nurses. You know, we are nurses first. This is a responsibility. I always tell people that you become a DMP, you become a doctor, whatever it is, you know, you're still a nurse. And nursing is advocating for our patients, you know. So the new students coming up, you know, new grads going on, our job is really to advocate for our patients. So if I go to the ER today and I fail to advocate for my patient, then I failed as a nurse, you know. And sometimes it's hard to do it. It's busy. We don't have enough people in the ED. You have 5,000 patients you are taking care of, but still our job is really to advocate for our patient. I encourage everyone to do that, you know. And sometimes I fail, you know, and that's why I have an accountability partner who say, hey, did you do this? Did you do that? You know, so that's all I have to share. Find an accountability partner and always advocate for your patients.
Wonderful. Thank you again. Let's give another round of applause to close out.
Thank you.